We are less than 24 hours after the surgery. We did a fusion, and you didn't ask me the usual question that somebody after open surgery asked me. Is it like, when can I get out of bed? When this pain is going to stop? When the spasm in my leg is going to stop? When am I going to be able to stand up? You didn't ask those questions. You asked a different question. What was your question?
I asked, coming next May, if I'll be able to use my boat and enter my fishing tournaments that I normally fish in.
Oh yeah, the answer to that is a sound yes. You will be. We have to build up to that, but the answer is that yes. You didn't ask those other questions. Why didn't you ask those other questions?
Because bass fishing is kind of my life.
Yeah.
It's my passion.
But you didn't ask when can you stand up or when can you walk or and so on, because you have done it already.
I've already done it. And,
yeah. So tell me, how was it today morning? What have you done have you been out of bed?
Yep. So sat up, got my brace put on, stood up, then had my brace put on. Went for a walk down the hallway into the physical therapy room. Walked upstairs, turned around, came back down them. This is with no walker, no cane.
Okay. And we are not 24 hours after the surgery.
No.
This is just the first morning
maybe
after.
18.
Yeah.
And came out of that room, walked down to the stairway past my room, turned around, came back.
How is the leg pain that you had before the surgery?
There is none.
There is none. And overall the pain, and how are you doing?
Just a little pressure where
the fusion. Yeah.
But it's not terrible at
how,
all.
How was it before the surgery? The pain and the discomfort and
my
so on?
sciatic was getting bad. I had a couple couple injections over a period of time, which helped greatly so I could continue working. But this past month, I don't know if it has something to do with actually getting my insurance and I'm actually having it, but my sciatic pain started coming back.
Yeah.
So about a month
No, first of all, it's not unusual. When you get an injection, the injection material, they numb up the nerve. So sciatica is not that it's gone, but you don't feel it anymore because the nerves are numb, but they come back. This is what you're describing is typical thing what I hear.
Yeah. So the surgery came perfectly because it continued to get more pain in my sciatic. I could still work, but I was sitting down a lot and hobbling.
Yeah. So how was life with all this pain?
It was a struggle.
Yeah.
I fought through a lot of pain.
Yeah.
To do my daily stuff.
Yeah. Your surgery yesterday was about 40 minutes. Our blood loss was 25 cc, less than an ounce, less than 1/10 of a soda can. And you already have walk. Do you feel you are ready to go home today?
I do.
Okay.
After I eat this food.
Well, and you are giving me a smile. Usually people after spine surgery don't feel like smiling, and that's all make me as a surgeon really happy that I'm able to do that for my patient. And so, what make you decided to get the surgery done? I mean, how was the process? What have you been told regarding spine surgery before the surgery?
I heard a lot of bad things.
Yeah. And for a good reason, because open old-fashioned surgery can do that.
Many more surgeries trying to fix that. But when I was referred to you by Dr. Cracker, I did all kinds of research on Inspired Spine and you, and I was excited.
Yeah. Now, let me just tell you all those bad stories you heard about the spine surgery. Unfortunately, many of them are true.
Right.
Because in an open old-fashioned surgery, either we cut your belly, go from the front, put all your abdominal organ at danger, and people have died of that.
Sure.
And then turn you over and literally fillet you open. You're a fisher. You know what that means. in the open surgery, we fillet spine open to
Yeah.
get to the where we need to go.
That
We
doesn't
didn't need to
sound
do all
fun.
of that. We didn't have to do any of that.
No.
Our holes to do the surgery are dime size, multiple small incision, and we do the surgery through a tube that is less than half an inch, like
Wow.
less, significantly less than half an
Right.
inch, and that enables us to do the job without really causing so much damage. And the result is that you already walk,
You know.
you went stairs up and down, you're ready to go home less than 24 hours after the surgery.
Mhm.
And you know, and your questions are, when can I get to my tournament, rather
Right.
than when this pain is going to stop, when can I, literally get out of bed and so on.
Yeah.
Well,
It's definitely awesome.
yeah, well, thank you so much for the interview. I really
Thank you.
appreciate that.